Welcome. You are now a Lake County Medical Reserve Corps volunteer. This unit is housed and organized at the Lake County General Health District. This presentation will explain the history and structure of MRC units, the important role it plays in community events, and general operating knowledge. During the State of the Union address in 2002, in the wake of the devastating September 11th attacks, President George Bush ordered the Office of the Surgeon General to establish the Medical Reserve Corps as a demonstration project. This project created a system to identify, train, and organize medical volunteers to strengthen their local public health responders in the event of human-made or natural disasters. In 2006, the Pandemic and All Hazards Act authorized the Medical Reserve Corps into law. Currently, the Assistant Secretary for Preparedness and Response oversees almost 300,000 volunteers and over 800 units. These units consist of doctors, nurses, pharmacists, and other volunteers with diverse professional backgrounds. They are organized in local community units, in most cases with local health departments and emergency responders. The MRC mission statement is to establish a network of local volunteers who are willing and able to donate their time and experience to supplement existing public health and local resources during emergencies and their times of community need. MRC units participate in many activities. These activities include emergency preparedness and response training and exercises, emergency shelter operations and medical care, disaster medical and behavioral health support, medical facility surge support, mass dispensing efforts such as medication, water, and other supplies, disease testing and surveillance, community vaccination clinics, veterinary care, support services to disaster call centers, family assistance centers, and reception evacuation centers, emergency operations centers and communication support, patient movement and support, search and rescue operations, disaster cleanup and recovery support, first aid and medical support during large public gatherings, community education outreach, emergency preparedness response planning, logistical and administrative support, and much more. Recently, MRC units have assisted after devastating hurricanes, including Hurricane Sandy, that wreaked havoc on New York and New Jersey. Over 6,000 MRC volunteers from 150 MRC units responded to recovery efforts from Hurricane Katrina, Rita, and Wilma. Almost 50,000 MRC volunteers from 600 units responded to the 2009 H1N1 outbreak by helping administer vaccination efforts. MRC units have logged over 14,000 hours during the 2014 Ebola scare by helping suspect case screenings, health education, and call centers. During the 2016 Zika outbreak, 140 MRC volunteers helped in the community education, reaching over 17,000 individuals. In 2018, MRC units provided medical support, psychological first aid, and animal rescue support during devastating wildfires in the western part of the United States. During times of non-emergencies, MRC units help out at community events by providing education, working at immunization clinics, and continue to train by participating in drills and exercises. Although locally we don't experience many natural disasters, the Lake County MRC unit prepares for other possible dangerous events, such as a peri-nuclear power plant radioactive release. In such an event, the Lake County MRC unit may be called upon to activate and staff potassium iodide point of distribution centers and community relief shelters. MRC members also participate in local events by providing free blood pressure screenings, help package potassium iodide, participate in vaccine clinics, help out charitable events, and much more. All of these activities and training strengthen the local community infrastructure and enable communities to meet specific health needs. The vast Medical Reserve Corps volunteer knowledge base provided by its members also strengthens the first response efforts of the local fire, police, and health departments. When you join the MRC, you become a member of a much larger response organization. MRC units exist in 49 states and multiple U.S. territories. Nearly 800 units over 10 U.S. regions are ready whenever disaster strikes. The incredible variety of skills provided by MRC volunteers are supplied by doctors, nurses, pharmacists, dentists, EMS professionals, veterinarians, mental health professionals, medical support staff, physician assistants, clergy, and many other support positions. You are now a member of our local Lake County MRC unit with almost 170 members possessing a wide range of skills and knowledge. Recently, MRC units nationwide have responded to many natural disasters, infectious outbreaks, human-made disasters, foodborne illnesses, and other emergencies. Remember, the MRC is built on an incident command structure. MRC volunteers should never respond independently to emergency situations. You will be contacted by the Lake County General Health District for any activation status changes. Once you report to your assigned location, an incident command briefing will decide the MRC's role and function during the event. When working with any emergency event, you should not respond to any media inquiries. The Public Information Officer is responsible for any media updates. For further information, please contact the Lake County General Health District, the Department of Health and Human Services website, or the Ohio Responds website. Thank you for becoming a Medical Reserve Corps volunteer.